Warm welcome to Pediatrics with Dr. Saeed Kazmi. You're watching my YouTube channel. Today, we're going to talk about causes of high alkaline phosphatase in children. Why I have chosen this topic. Few days back, a child was sent by the GP to the emergency department because this child underwent certain investigations for his underlying problems, which I think were some ongoing issues with body aches, bone pains, and as a part of the workup the GP did a few tests, and what he noticed that his alkaline phosphatase was quite high. I think it was around like 1300 or 1400 international unit per liter. So he was sent to the ED to be seen either by a pediatrician or somebody who has got experience in pediatrics. So I thought that I would take this opportunity to explain this enzyme and its levels and how to interpret this thing. So alkaline phosphatase is an enzyme. Now this enzyme is produced by different organs in the body, the most important one being bone, then liver, then intestines and placenta. So these four organs, bone, liver, placenta and intestines, they basically produce this enzyme. So whenever there would be a high activity in these organs, for example, if there is a pathological process going on in liver, or there's a pathological process going on in intestines or in liver, Hello friends, welcome to my YouTube channel. I'm Dr. Saeed Kazmi and you're watching Pediatrics with Dr. Saeed Kazmi. And today I will be talking about causes of high alkaline phosphatase, also known as ALP, in children. Why I have chosen this topic is because a few days back a child was actually sent by the GP to the emergency department because as a part of his ongoing workup for his body aches and bone pains, the GP found out that his alkaline phosphatase is very high. I think it was around 1300 or 1400 international unit per liter. So he was sent to the emergency department to be either seen by a pediatrician or by someone who has got experience in pediatrics. So I thought I will take this opportunity to explain what is this enzyme and why sometimes its level can be high in children. Now ALP, alkaline phosphatase, is an enzyme basically, and it is produced by four organs in the body, the most important one being bone. So bone is the most important organ in the body which can produce this enzyme, and usually when there is a lot of bone activity, as you see in children, because they are passing through the growing stage, the alkaline phosphatase levels can be high. So this enzyme is primarily produced by bone. Then it can also be produced by liver, by placenta and by intestines. So in if there are certain disorders of the hepatobiliary system, liver, or of the bones or of the intestines, and even in pregnancy, this enzyme can be in high amount in the blood. So these four organs, they produce this enzyme. Now the normal level of this enzyme in adults is around 100 to 400 international units per liter. Now the levels are usually high in children because they are passing through the growth phase. So primarily the pediatric alkaline phosphatase comes from bone. Why? Because there is a lot of osteoblastic activity going on and kids are growing, so their bones are growing. So there will be a lot of spillage of this enzyme into the blood. So naturally you will find out that the ALP levels are quite high in children. In children the levels could be anywhere from 400 to 1000 international units per liter, and specifically they can be on the higher side usually in the early age, and then it can also go high in somewhere in the adolescence as the bones are growing and more of this enzyme is spilled into the blood. So remember, the alkaline phosphatase can be high because of physiological causes, and it can also be high because of pathological causes. So let me first go through the physiological causes. Now the physiological causes, the most important one are what we call as rapid growth spurts. Now kids are passing through the growth phase, and there are certain times when the growth spurts occur. That's usually in the early part of childhood and then in the later part of childhood. So you will see that these are two parts of the child's life where the growth spurts occur, and while the growth spurts is occurring, the bones are growing, and you would see higher levels of alkaline phosphatase in their blood. It usually peaks during infancy and then later on during puberty. So at these point in times, you might see that the levels are high, like around 1000, maybe 900, 1000. So that's quite normal at this age. Then it can also occur because of a condition which is quite common in children less than 5 years of age, and that is known as transient hyperphosphatasemia. Now you have to differentiate this thing from hyperphosphatemia. This is not hyperphosphatemia, this is hyperphosphatasemia. Remember, phosphatemia is basically increase of phosphate ions in the blood. So it's increase of phosphate, while phosphatasemia means increase of alkaline phosphatase enzyme. So these two conditions are different. Phosphatemia, more phosphate in the blood, which can occur because of hypoparathyroidism. It can occur because of end-stage renal disease, but this is hyperphosphatasemia. So transient hyperphosphatasemia, in which the alkaline phosphatase level is quite high. This is quite common in early childhood. So it can be high in children who are less than 5 years of age, and we call it transient because they're going through growth spurt. Everything else is normal. So important hallmark of transient hyperphosphatasemia is just that the alkaline phosphatase would be high, but rest of all the parameters normally which we do as part of this workup, for example, the liver enzymes, they would be normal. The calcium and the phosphate levels would be normal, the parathyroid hormone levels would be normal, and the renal function would be normal. So if everything else is normal and these kids less than 5 years of age have got a high ALP or alkaline phosphatase level, we call it transient hyperphosphatasemia, which is quite a common condition, but it's transient, so it's resolved on its own. So these are some of the normal physiological reasons that can cause high ALP. So that is rapid growth spurts. As kids are growing, their alkaline phosphatase is always on the higher side. That's why we use a higher normal limit for children, that is 400 to 1000, as compared to the adults where it is 100 to 400 international units per liter. Now coming down to the pathological causes. Pathological causes. Now, most importantly, as I told you, that bone is one of the most important organ in children that is responsible for bulk of this alkaline phosphatase. Though as I told you, it can come from the other organs as well, but by and large, it's usually the bone. So bone related pathological causes, for example, in children, rickets. Any form of rickets, whether it's nutritional rickets, whether it's the vitamin D dependent rickets or vitamin D resistant rickets, that can sometimes lead to increase in alkaline phosphatase levels. Why? Because when the bones are weak, what is happening, there's a lot of bone metabolism going at the same time. There's a lot of osteoblastic activity, though this is pathological one, but as this activity is going on, this enzyme spills into the blood and you will see a higher level of alkaline phosphatase. The other pathological cause for high alkaline phosphatase in the blood are liver related problems, especially cholestatic liver disease, because alkaline phosphatase is usually high when there is cholestasis. Cholestasis means when there is obstruction to the flow of bile. For example, in biliary obstruction, if there's a stone in the biliary tract, or there is a stricture in the biliary tract, or there is an atresia of the biliary tract, like biliary atresia, or if there is a other form of obstruction, extrinsic obstruction, like choledochal cyst in kids. So these are all example of obstructive liver disease. So whenever there is an obstruction, it leads to cholestasis, and there will be cholestasis, there will be more of this alkaline phosphatase enzyme in the blood. So liver related cholestatic problems can lead to high alkaline phosphatase. Then there are other conditions in which the alkaline phosphatase can be high. For example, in hyperthyroidism, where primarily the thyroid hormone is on the higher side, still alkaline phosphatase can be high. Why? Because there's a hypermetabolism going on. It can also go up when there's a chronic kidney disease, or there's malignancy, especially when the malignancy is affecting the bone. So, for example, if there are secondaries in the bone, or there is primary bone disorder like Paget's disease, the alkaline phosphatase would be quite high. So how do we know, or how do we differentiate between a normal physiological higher alkaline phosphatase and a pathological is that you have to look into the other blood tests as well, because you know that primarily it comes from bone and liver. So usually if it is associated with, let's say, low calcium and low phosphate, then you can think of a nutritional problem like, nutritional rickets or other forms of rickets as well. Especially in that particular case, you might have to do vitamin D levels like 25 hydroxy vitamin D level or 125 hydroxy vitamin D levels. So if it is associated with low calcium, low phosphate, then you think of bone related problem in children, rickets or other forms of nutritional rickets, vitamin D dependent, resistant, like, that's altogether a different field. So some form of bone disorder can lead to high alkaline phosphatase in the blood. Then the second thing are cholestatic liver problems. And cholestatic liver problems, that's why whenever you are interpreting a high alkaline phosphatase, you will look at the calcium, the phosphate, and the vitamin D levels. At the same time, if you are thinking of a liver problem, like let's say there is some form of jaundice going on, then you have to look at the liver enzymes as well. Especially if there is a rise in ALT or AST, then you would be thinking of a cholestatic problem. And then you can further do other relevant tests like ultrasound to find out if there is an obstruction somewhere. So a normal alkaline phosphatase would not be associated with derangement of other blood parameters like calcium, like phosphate, like vitamin D levels, or in renal function levels, or in liver enzymes. But if it is associated with the derangement in these blood tests, then obviously you can think of relative disorders in those particular organs. Now, should you worry if somebody has got an increased alkaline phosphatase level if it is a child and hasn't got any symptoms? No, not at all. Like, for example, in this particular child who was sent by the GP, we found out that the vitamin D levels were fine. We found out that the liver profile was normal. We found out that the thyroid profile was normal. We found out the renal function tests were normal. So nothing to worry about. Like a 5-6-year-old child who has got alkaline phosphatase on the higher side, but he's otherwise fine, should not be worried about. And because this is a physiological high alkaline phosphatase, and the only one thing is that if you are too much worried, then you can just recheck the levels, especially if they are very high, to see if they come down or not. So I would say you should only get worried if the levels are persistently above 2000 international unit per liter. Because if it is more than 2000 international unit per liter and it's not transient, or it is associated with the derangement in other tests, for example, deranged liver profile or deranged renal profile or deranged bone profile, then you should be worried about that. But remember, any child who has got high increased alkaline phosphatase level and is not having any other symptom, one should not be worrying about. You only worry if there are associated symptoms, like presence of certain symptoms or sign related to bone or liver disease, and there is associated other lab abnormalities. So if somebody has got high alkaline phosphatase, you need to check first of all the age specific reference range. I told you that in kids it can be anywhere between 400 to 1000. So if a child has got 700, 800, even close to 1000, you should not be worried about if there is everything else is fine. So you also have to take a history and do a physical examination, because if somebody is showing some hallmarks of bone disease like bowed legs or other features of vitamin D dependent or deficient rickets, then probably you would be thinking of the bone disorders. So, or similarly, somebody's jaundice, you'll be thinking of some problems with cholestasis. So you have to take a thorough history and do a thorough examination to see if there is anything that can point towards a pathological cause of high alkaline phosphatase. If it is high, you can repeat alkaline phosphatase after a couple of weeks if the child is well. And you have to do relevant tests as well. I told you in the beginning that alkaline phosphatase comes from bone and primarily for liver. So you have to do the bone profile, you have to do the liver profile to see if anything is wrong with them or not. If they are normal, you don't need to worry about. And sometimes you can also consider doing the alkaline phosphatase isozyme testing, because alkaline phosphatase coming from bone is different from that alkaline phosphatase which comes from the liver one. So you can check the isozyme to levels to see where this high alkaline phosphatase is coming. But I think In a child who's otherwise well, you don't need to do these expensive tests. If somebody hasn't got any symptoms, he's fine, and it's just like a high alkaline phosphatase, that is physiological and should not be worried about, because kids always have got high alkaline phosphatase, and that usually comes back to the normal stage once they are out of that growth spurt level. So this was a short lecture on causes of increased alkaline phosphatase in pediatrics. So if whenever you come across a child who's got high alkaline phosphatase, look for bone profile, look for liver profile, take a good history and examination, and then make your mind whether this is physiological or whether this is pathological. If it is pathological, you will manage accordingly. If it's physiological, nothing to worry about, just reassurance to the parents. Hope you have learned something from this video. Take care and bye-bye.